Thank you very much for your comment. I've picked it because I've seen similar comments on the same conversation. So let's try to understand it. You're saying, but stimulant of Miraa is the same as drinking a cup of coffee. No, not similar at all, because coffee works differently from Miraa in the body. Miraa contains cathinone and coffee contains caffeine. And now caffeine and cathinone target different sites in the brain and have different effects. They might have some overlapping effects, but have different effects. So to correct your statement, I would say, but stimulant of Miraa is the same as taking amphetamines. Amphetamines are the medications that we use to treat ADHD, Adderall. So we know that the chemical structure of amphetamine is similar to that of Hertz or Miraa and have the same effect. So there is a possibility that scientists may be able to extract cathinone for medicinal use. There is a possibility if it's not already happening. So when we're saying that Miraa is a drug, we're not saying that it should be banned. We're saying that it has the potential to cause addiction. Because if I'm prescribing Adderall to you for ADHD, I have to warn you that it has the potential to cause addiction. If I'm prescribing, let's say, tramadol, opioid, then I have to tell you that it has the potential to cause addiction. Tramadol is the same class as heroin. Heroin is a semi-synthetic opioid, so it's added other things that make it more intense and more instant in action. Tramadol is the same category as morphine. We give you morphine in theater. We give you morphine after surgery. Morphine is a natural opioid, yeah? And so perhaps it has less tendency to cause addiction as heroin. ENT doctors sometimes use topical cocaine to numb the areas that they want to operate on. So these drugs that we are calling addictive drugs, we use them medicinally. We have the dose that we are supposed to prescribe for, and we know that if a person has these comorbidities, these other illnesses, then we have to be cautious about prescribing this dose. If a person has kidney failure, we have to take these precautions. If a person is using this other drug, then we can prescribe this drug. And so for us, we have a lot of evidence from scientific research to guide us, to inform us on how to prescribe these drugs. So if I prescribe to you 20 milligrams of Adderall, and then you start feeling the alertness maybe, or the increased focus, and now you want to increase the dose on your own, then that becomes illicit use, because I'm giving you the clinical dose and you are going to add it on your own. So for example, if you are tired or stressed out, instead of resting, you decide, let me take some more Adderall to just keep me more focused. That's illicit use, and that is likely to put you into now developing the addictive disorders. So us saying that Hearth is a drug does not mean that we're encouraging it to be banned or we're against it. We're just saying that from the studies that we have seen that it has the potential to cause addiction in some individuals. And so that is the information that we're giving as clinicians. Whatever authorities decide to do with that, our role ends at it has the potential. What we've seen from studies is that it has. The same way that amphetamines has a potential to cause addiction, the same way that diazepam, the medication that we give you for calming down or for sleeping, alzolam, clonazepam, all these drugs have the potential to cause addiction. I can give you pethidine for pain. Patients with sickle cell disease tend to use pethidine, and most of them have developed addiction to the pethidine because it has the potential to cause addiction. So yes, it helps with the pain, but now they're using it for the other psychosocial aspect that it helps with, the euphoria that they get from using pethidine. So for your statement, Miraa is very different from coffee, but caffeine is already listed under the category of substance-related and addictive disorders. So caffeine in coffee has the potential to cause addiction. So what we're saying is Miraa as well has the potential to cause addiction. So it would be added to that category in some time, but again, it does not mean that it has to be banned. And I'm hoping that helps clear things up. When we say a drug has the potential to cause addiction, we're not saying that it has to automatically be banned. The reason why the focus on Mogoka right now to be banned is because of the adverse effects that we're getting, even with small quantity use of Mogoka. And again, like I said, we still need research from the patients who've already been affected to see how much quantity they consumed and how that has affected the onset of psychiatric manifestations. So for Mogoka, it's not so much about addiction, it's about the adverse effects that we're getting immediately after a person chooses Mogoka at whatever amount. I'm hoping that helps with understanding the point of calling Miraa a drug.